There are so many things that we love to do that can actually put a strain on your heart. So joining us today is Dr. Reynaria Pitts with Health One. Thank you so much for coming in bright and early.
Thank you for having me.
We appreciate it. Okay, self-admittedly, I didn't always think about this, but what is happening and what activities are you particularly worried about when it comes to your heart health during the winter?
Well, during the winter time, it's cold outside. So I worry with my patients that they're more sedentary. They don't want to go outside. It's cold outside. During the summertime, they're usually much more active, maybe go out for walks. But during the wintertime, when there's snow outside or it's icy, they may not be more physical. And so I always encourage them to try to get in any sort of activity during the day. It could be indoors, of course, and we have great recreational centers, for example, or YMCAs. So definitely trying to get some sort of physical activity in. In addition, we are also blessed with, some really good days, even though it's wintertime. We can have weather where it's in the 60s and it doesn't feel like winter. So definitely try to take advantage of those days.
I was just reading an article about the effects of maybe like falling out of habit with your workout, whether it's whatever it is, can actually settle in maybe faster than people expect.
Right, exactly. I mean, a few days, a week, and then then it becomes more difficult to restart at that point.
Are there any particular patients you're the most worried about at this time where you would really encourage people to get out and get that exercise?
You know what? I feel like everybody.
Yeah.
Everybody needs to get out, or everybody needs to really think about their cardiovascular health. Whether you're a teenager, young adult, older adults, people should think about, what they can do to improve their cardiovascular health.
Yeah, absolutely. And so for folks who today's actually a really great day for that because you can actually get out in the morning. Are there any particular, are you worried about people who are maybe sedentary and then all of a sudden start up their exercise? Like, do you need them to ease in, or what's the best way to go about that?
Yeah, it's always never, it's always good to, start, something so heavy or intense at first to try to feel out what kind of physical activity works and, what feels good for the person. But if somebody is sedentary and all of a sudden they are starting to exercise, they may experience symptoms that they never experienced before. So that's always concerning. And if it feels severe or feels, off to them, then I would definitely try to seek, medical help or, recommend, see their primary care doctor.
Sure. And it can be, it's so simple, right? Like whether it's a walk or something like that, but can you walk people through the impact it's having on a person's body, that it is impacting your cardiovascular health?
Yeah, I mean, any physical activity will improve your cardiovascular health. So definitely daily walking, moderate intensity exercise. The American Heart Association recommends at least 30 minutes of moderate intensity exercise 5 days a week or 150 minutes a week.
Okay, awesome. Well, we really appreciate, you coming in. It's a good day, so take advantage of the sunshine, get out, get that walk in, get moving, and know that it has, impacts head to toe.
Yes.
So we really appreciate it.
Thank you so much.